knee replacements, it's very common that the knee will be somewhat resistant to flex, what we therapists call flex, or you'll think of it as bending the knee. And we want that knee, initial goal is to get 90 degrees, and your surgeon will tell you that that's your first goal, but you eventually want to get to 100, 110, maybe even up to 120 degrees of flexion. That's about right there. And one way to get that to bend is, there's no real simple method. Typically you just have to stretch it and force it, as Bob talked about earlier, is get that scar tissue and break it apart gently. It's a little painful, but this particular technique I'm going to show you I found is very effective with all my patients. Okay, what you're going to need is a wheelchair. Okay, now I do this right in the clinic with a wheelchair I have with my patients. A lot of times you can get wheelchairs rented, or a lot of people from the VFW will have wheelchairs that they just can use because they have affiliations with it, and they can use it for a month, they can give it back, they know someone that has a wheelchair, whatever it may be. Get yourself a wheelchair. In the wheelchair, and what you're going to do is up against a wall, all you need to do, I just have a simple block here made out of a couple 2x4s so that you have a little distance from the wall. You're going to put your toe, this would be the involved knee, this is the one that had surgery. I'm going to put my toe right there, okay, and you simply put your hands on the wheels of the wheelchair and you push forward, okay. Watch out for the castered wheels in the front. If they get in the way, just push them out of the way. And let's say my knee is stuck here at about 70 degrees. I need to stretch it because I want to get to that initial 90-degree mark. Okay? One thing as a therapist I found people relax more, they have better results in bending their knee if they're in control of the exercise. So here we are, they have a lot of torque, a lot of control and power with their hands, and you push up to the point where it starts to pull, and then you come back and give it a rest. And we're going to stretch, get into that pain a little bit, and come back and rest. Okay, make sure you breathe while you do this. You're not holding your breath and going, ah, ah. That doesn't work. You need to allow it to stretch in a way and not force it. It's just a way to think about it. So if you relax, breathe, make it hurt a little bit, let it stretch, and then come back. And you're going to work at this for 5 to 10 minutes. And you're going to gain range of motion real effectively, as opposed to just pushing it real hard and trying to get it in 1 minute. Okay, that's no fun. That's how you get inflamed. That's how that makes you not want to do your exercises, and you won't have good results, especially the next day. So we're going to work on it gently and stretch it. And I have tremendous results with this in the clinic, and the patients that can get a wheelchair at home really like it as well.